Okay, now let's talk about administering IPPB. Well, in the planning stages, we really want to look at why do we need to do this treatment. So overall, the outcomes are that we want to improve inspiratory or vital capacity. We may want to increase force expiratory volumes or increase peak flows. IPPB can help with cough and secretion clearance. We may want to help clear the chest x-ray if somebody has a lot of white on their x-ray. Getting more volume will help clear some of that out. We may be looking at an increase in breath sounds or an improved oxygenation. So we really want to have a clear idea of what our outcomes are before we start. What are our alternatives? So once we know the goal of the therapy, which let's pretend it's an increase in volumes. We've been doing incentive spirometry with our patient and they're getting less than 30% of predicted, and at that less than 30% of predicted, we know that the treatment's not very effective. Their x-ray is becoming more white and they're having a hard time clearing their secretions. So what's the goal of the therapy? To increase their volumes. Could this goal be achieved by a simpler and less costly method? Again, that's why we start with either just deep breathing or incentive spirometry, because that's a much less therapist intensive treatment. IPPB, on the other hand, takes a few more resources and a bit more of the therapist's time. So we really want to make sure if we're going to invest that time, this is the best option. And we want to start with simpler and move up. So then we choose IPPB. So what do we need to do? Well, one thing is anytime we're delivering an aerosol, we worry about infection control. So with this, we're going to get a new circuit for every patient. And this is what most circuits look like. So it's large bore tubing that the pressure is going to be delivered to, several small pressure lines, and either a mouthpiece or a mask, depending on the patient. We have to make sure this new circuit works with our equipment before we walk in to the patient's room. So every circuit is set up and then it's checked for leaks. It's very important to not forget to check the circuit to make sure it's not leaking. Then we'll have to orient the patient to the treatment. We'll want to explain to the patient why the treatment is ordered, what the treatment does. It's going to push a larger amount of air into your lungs and help you get a larger lung volume. How does it feel? Well, it really feels like air is being forced into your lungs. So you really have to try to get the patient to cooperate with you as much as they can. And what are the expected outcomes? I sometimes describe to the patient that we're having, we've been trying to get you to deep breathe and that we haven't been able to clear out your lungs with the amount of breath you're able to take. This machine is going to give you a larger breath, so hopefully we can open up some of those parts of your lungs that have collapsed from you taking smaller tidal volumes. The patient's going to be sitting upright or in semi-Fowler's position. And then it's really important to have no leaks in the system. If the machine is leaking, the machine will never be able to reach the pressure that was set, and the machine won't cycle from inspiration to exhalation. So it won't end inspiration if there's a leak. So we have to eliminate leaks. The reason I said we have to test our circuit is there could be a leak in the circuit, and we want to make sure that's not the problem. And then there could be leaks in the patient. The patient can leak through their nose. If they're letting the air just come in their mouth and right back out their nose, the machine's not going to ever see that that pressure was met. So sometimes we'll use nose clips. We don't always have to use nose clips. You'll find that you can seal your lips around the mouthpiece and give a treatment in a fairly cooperative patient. but we do occasionally use nose clips. We can also use a mask or a mouth seal to deliver an IPPB treatment. Then we look at the machine settings, and we will be setting the sensitivity or trigger level. The sensitivity or trigger level is what the machine has to sense before the machine knows it's time to deliver a breath. Then we set the pressure. We'll talk about the pressure more, but the pressure is measured in centimeters of water, and we set it to as high of level as the patient can generally tolerate. Because pressure, the more pressure we get, the more pressure we're able to deliver, the more volume the patient should be able to achieve. And then we're going to set flow. So flow is, there's actually not a units on the Bird IPPB machine that we use, but flow reflects how quickly that pressure will be delivered. How fast a flow rate are we going to set? The breathing pattern that we like with IPPB is around 6 breaths a minute. So we're giving a much lower rate than normal because we're delivering such large volumes with each breath. We want to make sure the patient has plenty of time to exhale, and so we look at inspiratory to expiratory ratios of 1 to 3, whereas we should have 3 times the amount of time for exhalation, or 1 to 4, where we have at least 4 times the amount of time for exhalation.